Doug Ford has finally broken his silence about the situation in our hospitals after 20 ERs closed during the long weekend. The Premier maintains people who need care are getting it, but noted the ongoing strain on frontline healthcare workers.
They're exhausted. I get it. And, we couldn't function without the great work that they do. The nurses, the PSWs, the doctors. Do we need more people? 100% we need more people.
The Premier acknowledged hospitals and emergency departments are under increased pressure, but stressed that people who go to the hospital will be treated.
We're throwing everything in the kitchen sink at this. But again, I just want to emphasize 9 out of 10 people that are going into emergency areas, because we measure it, are getting taken care of within the health parameters. And I believe from the time they walk in, time they get treated, time they leave, it's within 8 hours.
Ontario has long faced a strained healthcare system. Hallway medicine started before Doug Ford became Premier in 2018. In fact, over 4 years ago, he campaigned on ending it. COVID has exposed and exacerbated the cracks in the system.
All of this has been building for a long time.
But the NDP's health critic places the blame on the Ford government for not doing more.
We are number 10 out of 10 provinces on the number of beds in our hospital. We are number 10 when it comes to the number of nurses that we have in our province. And yet we have a premier who says, oh, we need more money from the feds.
The opposition accuses the Ford government of waiting too long to address the situation in hospitals. The Premier and his health minister were silent through the long weekend as ER closures occurred, while a photo of them at a golf course circulated online and anger grew. Today, Ford was clearly on the defensive and in damage control.
It's happening across the entire country. It's, a matter of fact, happening across the world right now. We've hired over 10,500 new healthcare workers. We've added 3,100 beds. Every single jurisdiction in Ontario is either getting a renovated or a brand new hospital.
Now, the rosy picture that Premier Ford painted of the emergency room situation isn't entirely true. It's not the whole story. Take a look at these numbers. This is the length of stay in emergency for all patients admitted to hospital, according to the province's own data. On average, patients spent 20.1 hours in emergency, and only 24%, or 1 in 4, were admitted to hospital from emergency within the target time of 8 hours.